Hi, welcome back to the Chinese Medicine podcast. My name is Marie Hopkinson. I'm a Chinese medicine practitioner, and today we're going to be delving into our series for students, people studying Chinese medicine, and this was a special request series about the Zang or a video, which is going to turn into a series. So today we're going to be talking about the heart and what are the functions of the heart in Chinese medicine. So if you're a student and you're listening to this and you haven't already seen the intro, then I'd encourage you to watch the intro to this series and give you some context about how you can use this and what you can use it for. So I'm actually I've been on a little trip to Queensland and Sydney in Australia. I'm from Perth, which is the other side of Australia, big side opposite. And I've got a little bit of time today before I fly out, so I thought I would quickly film this episode for you. So I've been going around filming lots and lots of practitioners on the East Coast to talk about different things that they are really passionate about and special interest areas that acupuncturists and herbalists have. So those episodes will be coming out over the next couple of weeks. So if not already, it depends on what time you're watching this. So probably out already. Anyway, so you can go and watch those. And if you're not a subscriber of the channel, please make sure you subscribe and leave a comment below. I'd like to hear your comments. I do my best to follow people's advice. Some people say I speak too fast. Some people say I don't speak quick enough. And I will try. I know that some people struggle with the Australian accent, so I'll try to slow this down a little bit, and that's why the videos might be a bit longer. Cool. So the functions of the heart. Now what we're going to be using to talk about this is good old Giovanni. I'm going to be going through, just basically going through that text. Now this is the old version of the text. If you've got the new version of the text, that's really good. The things haven't changed. The functions of these organs in Chinese medicine have not changed since those texts were written. What's the difference in those texts is it's just there's more context to it, there's more information, there's probably a bit more research there. The reason why I'm using this text is because this is used for most foundations of Chinese medicine students, and most classes, most subjects have a unit called Foundations of Chinese Medicine. And the Zang Fu is best understood within the 5 elements. So last episode we talked about the wood element and the functions of the liver in the context of wood. So now we're going to talk about the context of fire and the heart. So these are the main functions, and most students will have to memorize these. So hopefully this will give you a bit more info about how to learn them if you're trying to memorize this stuff. Like you could put them on flashcards and things like that, and just try to understand why they do what they do. And it was recently one of the people I was interviewing, this episode may or may not have come out yet when you watch this, Michael Brown. He wrote he did a translation of an acupuncture text. And we were talking about tips for students and how you could remember stuff and how you could learn. And one of the tips he suggested, which I think is really, really useful, is when you do go through like your Giovanni or one of your main texts and you see these things there and you see the references to the classical text, go back and read those references and find out, well, what does that mean for you? How does that, what does that additional piece of information mean? How does that fit? So the functions of the heart are: it governs blood, it controls the blood vessels. Number 3, it manifests in the complexion, it houses the mind, it opens into the tongue, and it controls sweat. So we're going to look at firstly the heart governs blood. Now that might seem, okay, well that's simple because we know the heart pumps blood in Western medicine. It's the pumper, it's the pump system, the circulatory system. So Chinese medicine doesn't ignore that. It doesn't say, well, the heart doesn't pump blood, but it just talks about it in a different way. So yeah, the heart is involved in blood. And so when you have a patient with blood deficiency, which would be the pathology of a situation like this, there's 3 organs that you want to think of. The first one's the liver, the second one's the spleen, and the third one's the heart. And then even in addition to that, some people would think of the kidney or the water element as like a really resource-drained person. So let's think about the heart governing blood. What does that mean? So in this text he says the transformation of Fu Qi into blood takes place in the heart. Then B, the heart is responsible for the circulation of blood, just the same as in Western medicine, although in Chinese medicine other organs, notably the lung, spleen and liver, play a role in the circulation. So it's still that pumping of blood, it's that circulation of blood. Now it's really interesting to think of, especially when we think of pulse diagnosis in Chinese medicine, and the heart and its role to play with all these things. So in the blood vessels, like I guess I maybe should give a greater context to this. This is not meant to be a replacement for us. This video is for someone who's already done this in their class and they kind of want a bit more information. So I'm not going to talk about every single thing in detail as if I was teaching the class, because it would be probably be a 3-hour lecture or a 1.5 hour video at least. So I just want to touch on some aspects that you might not have thought of, or maybe you have already and you think, oh, that's good to remember that. And so in the context of the heart governing blood and also controlling the blood vessels, it's through the pulse diagnosis that the heart is directly communicating with you as the practitioner about the patient's body. And that is also through the Shen, so the awareness, the Shen or the mind. So I think in this translation, this version of Chericho, he talks about it houses the heart, houses the mind, which means the Shen, right? So what is our Shen? So every organ or Zang organ has a mental emotional association. So when we did the liver, we talk about the Hun. So when we talk about the heart, it's the Shen. Now, the Shen is a really massive one. I'll do a whole episode just on the Shen. And it's a massive one because it also, one part of the Shen is that it encompasses all the emotions of our body. So you have these emotions that, like joy is the emotion associated with the heart. It's incredibly humid here in Brisbane. It's one of those places where you just sweat and sweat and sweat. In non-air conditioned places, and lucky this place has got aircon, so that's lovely. But it's still hot, it's still sweaty. So what does the heart do in terms of the emotions is, joy is one of the emotions of the heart. Or joy is the key associated emotion. But it also, through the Shen, it kind of encompasses all emotion. Now, one thing with Shen is it's the awareness of our body. And there's a really great text on the Shen, because when you think about Shen disorders or Shen disturbance, that really relates to, in our Western medicine context, mental health, mental illness, and that kind of stuff. So if you're interested in learning more about that, then there's a book called, I think it's just called Shen. Elisa Rossi wrote that book. And that's a very well used text for TCM students, practitioners. It's much more of a read-along book, a reading book rather than a clinical manual, although there's lots of clinical stuff in there. It's not written in a way that you could just have a patient go, oh, they've got anxiety, what are the points I could quickly use, like, people use books like that. You really need to read that book, but it's great because you can understand what's going on. So in governing blood, it's something where, because the heart manifests in the complexion, that's where you'll see a disturbance of that. Now, what can happen is, if with a blood deficiency person, you can have a very pale complexion, and the person has what we call a dull complexion. So another way we assess patients in Chinese medicine is looking at their eyes, and their eyes reflect the Shen. So this is all to do with the heart, all to do with fire. And to do with joy, and it's got something to do with also the prognosis of illness. So when we come to talking about the Shen more, that's something where you would have learned very on in the first year of Chinese medicine school about looking at the eyes, and they say dull eyes reflects. Now, it doesn't mean the patient feels dull eyes. When you look in someone's eyes, do they have that sparkle? Do they have a gleam? Are they able to connect with you? That's all part of the Shen aspect of the eyes, and that can also be part of the complexion too. So, excuse me, when you're meeting someone for the first time, we're often assessing them. We're like, we give them a once over, especially if you're a single person and you're like, is this person attractive to me? And so you're giving them that once over, and you're looking at things without, just subconsciously, you're noticing their complexion, you notice their eyes. And because that also tells us about their demeanour. Now, you might meet someone that's very beautiful, like physically, they might have the perfect body, a beautiful physique, but there's something about them that you can't really connect with them, and sometimes that's because their eyes they just don't have that quality of Shen in their eyes, right? Or that quality in their complexion. And so that could be a lack of blood circulation issue with the heart. So with Chinese medicine, something to remember, especially as a student, is if you can commit these things to memory, they become really interesting and useful pieces of diagnostic information. But one thing alone isn't enough to make that diagnosis. There are some things along the way where your teacher might say, hey, this is a really important symptom, and that's exactly all that it ever means. But it's like a piece. So let's say I noticed someone had dull eyes. I don't just necessarily go, well, they must have a difficulty with their Shen, or they might have some kind of Shen disturbance, or a lack of Shen, or something like that. Then maybe they're tired that day and they have a lack of Shen at that moment, but does that mean they have a Shen disturbance, like in general? So some of these things are indicative of momentary changes that happen. But as a practitioner, you may notice, like over time, a patient, these changes happen in a patient. Or people that you notice. And lots of Chinese medicine is about observation. So this series is for students, right? So if you're a student, that's what you're supposed to be doing. You're supposed to be trying to observe people to learn. So that's what you should be doing. If you're on the bus or the train or something on the way home, look around and be observing people and see, well, what does that mean? What would that mean in Chinese medicine? What could it mean? Okay, so the heart controls the blood vessels. And this is something to do with, the actual pulsing of the heart, right, the pumping of the heart, is a heart function, but that is also reflected when we check the pulse. So that's how we would know, right? Now, patients might complain to you something like, oh, I feel like I've got poor circulation. So the symptoms they might have is tingling and numbness, or coldness in limbs, particularly. Those kinds of symptoms could be a blood circulation issue. Could be a blood deficiency. Now, those kinds of symptoms in TCM could be either lack of qi to move the blood, so lack of force to move the vessel. So last week or last episode when we talked about the liver, we were looking at that cyclical, rhythmical force of wood, and that's what actually moves the vessel. So when you have the 5 elements, you have wood, fire. So wood generates fire. You need that. That is a wood function of fire. So it's a wood function within fire. If that circulation, that movement. And so if a patient has that lack of movement, then they might have sufficient blood, but just not enough movement to move the blood. And you can see this with someone, like a good example would be if you were to exercise, what happens? Where does the blood go? The blood goes all to your limbs, because you've suddenly pumped wood, you've moved, you've increased the circulation, and that makes blood flow to the extremities and flow to the limbs. So people that exercise regularly are less likely to kind of have those kinds of issues. People that become very sedentary have much more issues. I don't know if you've ever had the experience where you've sat down for way too long and you've gotten a numb leg because you've sat down for 8 hours, or sometimes it happens to people on planes and things like that, and you've gotten tingling or numbness in your leg, or you're woken up at night because you've slept on your arm funny. Now that could be compressing a nerve as well, but in general, like a lot of our time, that's poor blood circulation. So if you get moving, you're actually applying that's a wood function, you're getting moving, and then that increases circulation, and the circulation is restored, so tingling, numbness kind of goes away. So a movement of wood is required to kind of move the blood vessels, and that's what you're kind of feeling when you feel the pulse. Literally you are feeling the pulse vessel, and that's the first thing that you feel. Like you're touching the outside of the vessel. Like, is the vessel itself, like if it was a drum skin pulse or a leathery kind of pulse, I think they call it. Like that would be. You're feeling the actual wall of the vessel get really leathery and thick, and that's a dryness kind of issue. The vessel itself is like drying out because of a lack of blood to even moisturize its own blood vessels. And so you could think of the pulse in a very general sense, like aside from the two sides of the pulse, and aside from the left sun being the heart itself. That the whole pulse is your Shen communicating to your body, to the practitioner, right? And so you have two aspects to the pulse. That vessel itself, but then there's also the blood within the vessel. What's the blood within the vessel doing? And so that's where, like, if a person had a blood deficiency, if there's less blood inside the vessel, so if the vessel's this big and it's full, let's say that's normal, but let's say it's half full. Now, it's not really half full, but if it is less full, the vessel itself gets smaller, and so that's when you would feel like a thin pulse, like a smaller shaped vessel, right? So you put your fingers on it, and it might be really big and flooding or full, or oops, in that book. And that's the opposite of a kind of a smaller shaped vessel. So the vessel itself will shape depending on how much is in it. It's like a hose that has the ability to expand. If more water's pushed through it, the hose will, pump out bigger. If less water's in there, it'll get, smaller. So, some of Chinese medicine is theoretically, like observational, metaphorical, I should say, metaphorical. But some of Chinese medicine is like just really common sense, standard, like just observing the body, not in a metaphorical way, but in a physiological way. This is what happens. So it manifests in the complexion, and the heart houses the mind, and this is the Shen aspect. So in one sense, you could think of all Shen disturbance issues in Chinese medicine. Now, when you study Shen disturbances, you'll know what I mean by that. But in one way, you could think of it as mental health issues. That all relates to the mind. That all relates to the Shen. Sorry, all Shen issues like that, mental health, anything to do with your mental health relates to your heart or your fire element. One thing that's that's in a very broad sense. Now, there's also other ways to look at it and to think, okay, if this person had a lot of anxiety, let's say, that would more relate to the spleen and the earth, right? Because the spleen is in charge of worry and pensiveness and that kind of stuff. So you can't sort of get away from that. But there's still also the heart governs all the emotions in that way, right? And then last week, I think when we looked at the liver, there is also this aspect of the liver ruling all the emotions, and that's the idea of any emotion eventually culminates into anger and that frustration, and that it ultimately culminates into stagnation and blockage. So if that's happening, you could more look at that wood. So one thing we want to talk about specifically with the heart and the Shen is joy. So the emotion that's associated with the heart is joy. And now that's kind of like happiness and joy. And in Chinese medicine, any emotion you could have an excess and a deficiency of, like not enough or too much. Now you might think, well, you're happy, you have too much joy. That's just silly. Like, why could you happy be too happy? So it's not necessarily about happiness, but too much joy is like euphoria. And it also can be inappropriate joy. So you sometimes find patients or people can't stop laughing or are laughing inappropriately. Like people that say, for instance, they feel sad, they go to a funeral and they laugh. That they actually are not doing it disrespectfully, but they just have this desire to laugh. So that could be a way of thinking, that could be a way you could see it. And again, the emotion stuff is a whole other thing. So this is just trying to keep this real basic, but giving you some kind of a taste of what's to come if you're in first year Chinese medicine school. So joy is sometimes, so a person that then has too much joy could be that euphoric kind of person. It could also be in a mental illness situation. You can see it in bipolar disorder where a person has like an excessive amount of joy and euphoria, and they really want to seek that pleasure, and they kind of lose the ability to judge for themselves how these behaviours might be detrimental to them. So for instance, sometimes people who have a manic episode in a bipolar situation, so they go from being depressed and then manic. When they go to a manic state, some people just spend a lot of money on clothing or shopping or something like that. Some people go and have a lot of sex and they just find lots of partners. And they don't have, it's like their brain has shut off the ability to reconcile that, hey, this might be detrimental to me, or this might not be something that I might do. Like, let's say I love chocolate. even though you might eat some chocolate, you still know, hey, I can't eat too much of this, or this is bad for me, or I shouldn't, that you kind of have that idea of, so you don't just keep going, doing this, that thing that's bringing you pleasure, because anything that's pleasurable, like too much of it, is ultimately often not good for us. Not everything, but there's lots of things like that. So I'm sure you can kind of get the idea, and that's what excessive joy or too much joy would end up doing to you. The other side of the heart joy is like no joy or not enough joy, and like in a clinical sense, it might be something like actual clinical depression. It could be someone that feels depressed, and not enough joy could be also like linked to wood not being able to generate fire. And that's something I see very commonly in the clinical sense. Like if wood doesn't generate fire in an emotional sense or mental sense, people don't get the purpose driving the joy or driving the passion. So you might want to go back and watch this episode I did with actually a Chinese medicine student that I know, Glenn, and we were talking about Ling, which is purpose in, well, not exactly purpose, but it can be translated as that, life purpose, the magic of life, connecting with that. And that is a wood fire kind of axis that you see there, but you also see that kind of drawing on the water aspect, like water nourishing wood, and then wood generating fire. So what happens is like sometimes people just lose track of what they're meant to be doing, and then they don't feel happy doing it, and they get stuck in a conundrum of, oh, I've got to go to work because I have to pay my bills, and if I don't pay my bills, life will get much significantly worse for me. So I'm not saying go and quit your job, but it is a situation where people find themselves in, particularly in our Western lifestyle, right? So that can lead people to feeling depressed and flat and just a lack of joy. There's some things in life where you have to do them because you have to do it, and you can endure that. It's not an arduous thing, and so there's not like there's a lack of joy there. It's just like, oh, I have to do this, I don't want to do this. Like I might enjoy a clean house. I don't like cleaning, but I like the end result of the clean house, so I do those jobs, right? But a lack of joy person kind of probably loses the ability to see that, and then they often end up with a very messy house because they're like, well, what's the point? They might get very overweight because they're like, well, I don't care about my body, I don't care about exercise or diet, I don't care about any detriments that might happen to me. They're just looking for anything that can make them feel a little bit better, or maybe even that they don't even care about anything and just letting things go. And that would be a really severe kind of case. And like, so I just want to give you some ideas about how this kind of stuff fits in an actual clinical sense in the real life kind of world. So housing the mind is a massive thing, because so you've got that aspect of the mind and joy, but then you've also got the aspect of consciousness, awareness, thinking, so thinking and committing things to memory. That is also relates to your earth and your wood. Memorization can also be a water, kidney kind of aspect as well. But certainly for the fire and the heart, like the consciousness, the fact that we are conscious, and the fact that we go to sleep is part of our Shen. So when you don't have very good sleep, or any kind of sleep disturbance, then you are not resting your Shen, right? Because your Shen is awake or active when you're awake, when you're conscious. And so when you go to sleep, what happens is you can imagine it like your Shen being up here, because that's in your brain and your head, and then as you go to sleep, your Shen kind of goes down here into your heart, into the blood, and rests in that blood. And that's how it's a metaphorical way of thinking about how it functions or how it acts. So I tell my students something like this, like when you go to sleep, you'll often lie down, so you're resting your body, you're not placing a strain on your body, so your mind can go, right, okay, well, all the blood can come back to my torso area now, I don't need to, the fight or flight is definitely should be gone, those kinds of things, so you're not needing to run away, not needing to be active, your body is starting to shut down in that way, in terms of resting, right? And you close your eyes, and so you're closing off the different senses of your body so that you can fall asleep. So you close off your mind to noise, so hearing, sight, those kinds of things. And as those things close off, your Shen kind of is able to rest. Now, there are some things with insomnia or difficulty sleeping where it's an inability of the Shen to rest because the Shen doesn't have a place to come back to and rest. So think about this. This is an example I give my students a lot. Like, if you're very tired and you want to come home and sleep.
Why didn't you just go home? That's your home! Are you too good for your home?
Like, I know I'm going to be like that tonight after going on the plane, right? I'm going to fly 5 hours, I think it is, from Brisbane to Perth. So you fly on the plane, right? And you just like, oh, you get home, you're like, I just want to go to bed, I just want to go to sleep. But you can't, and you come home and you're like, there's so much stuff all over your bed. It's covered in stuff. And you can't find your bed. It's not made, or you strip the sheets off and there's nothing. And you've got, oh, I'm so tired and I have to do this. And it's not a comfortable place to rest. It's uncomfortable. Okay. Another example would be it's very hot and you can't sleep and you don't have any aircon. You're just like, oh, I'm restless. I'm hot. I'm restless and I can't sleep. You may be able to fall asleep, but if it gets hot overnight, let's say, you wake up. Or sometimes it can even be because you get very cold, you fell asleep, and then it got cooler in the night, you didn't have enough blankets on, you wake up because you're cold. Now, those are physical disturbances that are causing our Shen to wake up like that, because because our body's uncomfortable. So your mind, one job of your Shen is to keep us safe. And if we don't have consciousness, we can't act, we can't keep ourselves safe, we can't get ourselves away from danger or something like that. Yeah, so it's not a comfortable place, and so therefore you're kind of waking up because your Shen's going to try to wake you up to keep you safe. The same thing can happen metaphorically in your heart. We would think of the blood being that bed, right? So the heart blood is a place where the Shen rests, and it's like as that Shen comes down, this is just all metaphorical, right? It's just an example. Comes down and rests in that bed of blood, and the blood nourishes the heart. The blood nourishes the Shen, and you have a peaceful sleep. And then when you wake up, that Shen is kind of no longer needing that rest. It's kind of comes back up to your mind, and you're back up to your head, and you become awake and you become conscious. So there can be loads of degrees of disturbance of the Shen at night that could cause problems with sleep. So anything ranging from dream disturbed sleep, like nightmares, very vivid or conscious kind of dreams, through to just a person that dreams a lot. Like they might have real nice, or they might think they're nice, like adventurous dreams, or just dreams, right? And that is considered like it's considered that your Shen won't be getting as much rest as it should be, right? It's not able to rest. And then you get things like where, like if your house was broken into, it can be very hard to feel safe at night, because you're worried, like especially if you are a very peaceful sleeper and you weren't expecting that, and then one day, someone breaks in, and then you're like, next thing you know, I can't sleep because I'm worried that someone will break in all the time. Your mind is kind of doing that, triggering you every time you go to bed. Hey, that might happen again. You should be careful. That kind of stuff. So treating this stuff can be a multifaceted approach. Like there can be lots of things needed. The person might need to have psychology, psychiatry. They might need to do some cognitive behavioural therapy. Like herbs or acupuncture might be the road that you go down. But if you are using those therapies, then this is how you would look at it. You would think it. So if the patient came in and said, "Oh, I've got trouble sleeping," this is the way we would kind of look at it in terms of, okay, is there a Shen disturbance there? And so, yeah, hopefully this will help you understand how that Shen is linked to the heart. Why does the Shen house the mind, and what is the issues if the Shen is housing the mind, and now there's a Shen disturbance? Well, what does that? How would we understand that? And furthermore, like how would you treat that in an acupuncture sense? And that's why we would treat the Shen through the heart, right? And not literally stabbing the heart with an acupuncture needle, but you would use a treatment that either tonifies the heart blood, or sometimes you could have fire, heart like we're not going to talk about patterns of disharmony so much in this series, but like patterns of disharmony could be like heart fire, or some kind of like. So when I said about you waking up at night because it's hot, some people have hotness in their body, and so that heat is kind of that stagnation of qi, sometimes causing heat, and then that heat, or they could even have deficient yang, so that's like yang not rooted properly, not consolidated, kind of rising up, and then that disturbing their mind, disturbing their Shen. And so they're basically having this time of activity, which is what dreams are, when they should be resting. So sleep is a time of yin. You should have as close to, solidarity and cool and calm and just less, like just routine, that kind of stuff is good. Less chaos, right? And so yang is the opposite of the yin, and that's the activity, and that's the go time, and that's fine. If people have a very busy life, really busy day, they can then usually cope with that if they have good sleep and so forth. So hopefully this gives you an idea of understanding what that means. You can read more about that in your textbook if you are following the Giovanni Maciocia textbook. He gives heaps and heaps of information about that in there. So the other thing that he talks about is, what is Shen? There's like so many different ways of describing it. So one thing I said is your alertness and your mind. And Shen is also the consciousness of our body. So the fact that we can feel, and when someone does acupuncture on you, they're actually connecting with your Shen. So your Shen is kind of the fact that you can feel, and when we feel pain, that is our Shen. So when you take painkillers, you're kind of dulling your Shen, and the Shen is pure yang. It's not a yin thing. So you're dulling your yang, you're killing your yang if you take a lot of painkillers in a way, right? Just another thing to kind of think about.
Thanks for listening to the Chinese Medicine Podcast. Did you know we're also on TikTok? And you can find shorter videos on Facebook and Instagram that you might like to share with your friends and family. You can also find our podcast on Apple, Spotify, and all places where you listen to audio podcasts. I look forward to seeing you again on the next video soon.